this is Dr. Adam Kopsky here at Advanced Rehab and Medical, and I'm coming to you here today to talk about our topic of the week. And so a lot of patients have come in and have actually asked me about this topic, and it's really good seeing people so proactive and wanting to learn. And so this one is actually about frozen shoulder, okay? And so I love the shoulder. It's one of the most mobile joints in our body, and so a lot of you maybe know a loved one or you yourself suffer from shoulder complaints, and maybe you're wondering what frozen shoulder is. And so actually it is just like the name says, it's frozen, okay? So basically what happens is the shoulder gets a lot of adhesions in there, and so the actual medical name for it is called adhesive capsulitis, and that's a fancy name for where adhesions break up and itis is inflammation. So when you get all those adhesions and inflammation building up in the shoulder, it's hard to move it, and so the shoulder becomes frozen, okay, and it's hard to move. And so actually what the research tells us is like 95% of how you get frozen shoulder is actually on a continuum of biomechanical dysfunction in the shoulder. So what happens is when you have these muscles, I'm going to turn around, on the back of your scapula here, which is part of the shoulder joint when we loop around, those muscles become weak. And so a lot of you may have a lot of pain when you start reaching overhead, and you can get to a certain point and you get pain. Okay, so if those muscles aren't strengthened and stabilized, we have a tendency to roll forward and we decrease the gap there when you raise your arm. And so that over time, that dysfunction will allow that shoulder to migrate up, and then we start rubbing and grinding. And so a lot of you may hear clicking into that shoulder, and so this is a chronic issue. It doesn't happen in one day, but over a period of years, okay, it becomes chronic, okay? And so what happens is that will set in there and become really, really agitated and really hurt, okay? So what do we do about it? Well, here in the office, we have very good treatments. We're posture specialists, so we get in, we get the shoulders back, and we work with you to rehab that shoulder to get motion in there and correct that biomechanical dysfunction. So just thank you for listening. If you have more questions about what it is and what we can do to help, we're here to help you. So I hope you guys have a great day.